Hi, today we're going to be talking about Chapter 15, which is the patient as an individual. Please make sure you're looking at page 317 and 318 for the objectives so you know what the important parts are in the chapter. So we're going to start off by talking about patients as an individual. This is so very, very important. Our patient's well-being is affected by our attitudes, by the level of concern we're showing to our patient, and also the technical skills that we know. The quote, I love this in your text, is, people don't care how much you know until they know how much you care. And this we talked about with Chapter 3 in the legal and ethical when we talked about the surgeons. You can have an excellent surgeon who has really poor people skills, and they are going to get sued far more than the surgeon with less skill but better patient skills. So those people that have a relationship with their patient, they are less sued than those who don't have a good bedside manner, regardless of the skill. And so that's why that, your attitude, your concern are so important to show when we're dealing with patients. People are complex. We all come in with different baggage, and sometimes it is baggage, but there are other things too, like our cultural influences, our personal experiences, our basic needs. Everybody's basic need is different, and we'll be talking about that. So we come together, in a very different place. And so each one of us are so different. And we have to remember to respect that and honor that. This isn't only dealing with just our patients, but it's dealing with everybody in our lives. People know when we care, when we're showing concern. People know when we're not. It's evident if you're talking to a patient and you have your back to them and you're rolling your eyes and tapping your foot, you are showing them a lack of concern. Turn around, talk to your patient, look at them, ask questions that makes that patient feel like you really are interested in what's going on with them and that you truly do care. What we have to do is realize that this uniqueness requires understanding and appreciation of the differences that make us unique. And I always talk about my kids when I talk about this because we have two children, our daughter, who's the oldest, and then our son. Our daughter is just the spitting image of my husband. They followed all the rules. They did everything right. They studied hard. They just were one of those straight-laced, just went through life doing everything that they were supposed to do. I found that more difficult to deal with because I am on the other end of the spectrum, as is our son. We are more like fly by the seat of your pants kind of people. We don't usually follow rules. If we have to learn by doing something and failing. I remember we would tell Kristen it was hot, she would never touch it. We would tell Brian it was hot and he'd touch it 16 times before he would get burned and think, boy, maybe I shouldn't do this. So it's very different. People are different. I really understood and related with my son because he was more like me. I had more difficulty with our daughter. My husband, on the other hand, had more difficulty relating to my son because he was more like me. And so we really have to take the time to appreciate and value those differences, even if they make you crazy. So they talk a little bit about the philosophy of individual worth. Every single human being has worth. That is one of those things that it's like, to me, it's like a duh, of course they do. Everybody is put on this earth for a reason. I believe that they have something that they're supposed to do. So your book talks about the philosophy of individual worth being based on the belief that every human being, regardless of personal circumstances or personal qualities, has worth as an entitled to and is entitled to respect as a human being. I think we are raised in a situation where that should be the norm. I know it's not, but I think it's something that we really, it would be wonderful if the world could all get on that same page. There's a number of reasons that it's not easy to accept everybody and to say, everybody has worth. And some of these things come up in our minds. Again, somebody comes into the office and they have a very different viewpoint than I do. My values are very different. I have to remember, whoa, it's not about you right now. It's about the patient. I may not agree with them, but I have to respect where they are. Okay, that's important. But it's very difficult. I don't want you to think it's easy going in there, because it's not. It's one of the hardest things I think I ever had to deal with as a healthcare worker, is accepting people and their beliefs when I didn't agree with them. The other problem is if we don't understand their culture or beliefs, we really don't have any business judging. The one thing that I learned, I worked down at Hopkins Bayview, and my gosh, it was an experience of a lifetime. I was raised in a silo of mostly, white, very little different kinds of cultures. And so when I went down there, my gosh, I think there were people from every single place in the world. And so were the patients. And so I would walk in and they would be doing something and I would ask about it and they would be more than happy to tell me. And it was so interesting to find out what their cultural beliefs are and why they do what they do. Most people are very open to explaining it if we ask in a respectful manner and actually seem like we want to find out about it. One of the other issues that we have that makes this a little bit difficult is people are on different socioeconomic levels. And so the education background may be different. And we talked about this in the last chapter. If you don't have a good education, then you're not going to understand things as well as someone who has a good education. And so we have to remember that. We talk to patients and interact with patients on the level where they are. How about that wonderful, rude patient, that one that always wants to challenge you or is always uncooperative? You always are going to have at least one, but we still treat them with respect. I always think to myself, actually, I think horrible things in my mind because they're irritating the heck out of me. But I don't ever let them know that. I put a smile on my face, and I don't know what's going on in their life. So I will say, oh, it looks like you're having a rough day. What's going on? And excuse me. Sometimes they'll tell you, oh, I just found out that this happened, or my child was just diagnosed. Or sometimes they'll just continue to be nasty and say it's none of your business. But at least I reached out and I showed them that I cared. You're going to have those kind of patients all the time. You're actually going to have some employees that they're going to probably drive you nuts as well. But we need to learn to try to get along and find out a little bit more about what is going on. So, empathy is when we're putting ourselves in the patient's shoes or the other person's shoes and trying to think about how it would feel. And, there's times I forget to do this. I get on a bandwagon. Oh, this is ridiculous. I really wanted this and I can't get it, yada, yada, yada. And then I have a patient coming in who's fighting for their life. And I'm thinking, you are such a schmuck, Lisa, because you're sitting here whining about a possession, and this person is just wanting to live to see their kids grow up. And so it's really, really, it humbles you when you look and put yourself in someone else's shoes. It just gives you a little bit of a different perspective of something you may have never thought of by having to be there. So again, be empathetic, be caring to your patients. They talk a lot about dealing with prejudice as well. And they describe prejudice as having certain beliefs and feelings about a person because they belong to a certain group or they have certain characteristics. So this could be race, cultural background, appearance, sexual identity. I can go on and on with a million different things. Usually prejudice is negative feelings. And we also call this a bias. Bias sounds so much better than prejudice. But unfortunately, it is a prejudice. And we all have one. That's the thing that's amazing. There are people that go, I'm not prejudiced. I do not, everybody's just wonderful, wonderful. And, somewhere in there is something that they are prejudiced. It could be that the fat people are sitting next to them on the plane. That is me. That would be, I don't know. It could be anything. But we all have some type of bias. And we need to be able to recognize that we have it. That is so important. Because if we don't recognize we have it, we will never be able to see people as unique individuals, and we're not going to be open to learn and to change. Again, you have to identify your own. A lot of our prejudices are actually tied to our belief system. And so here's one. Okay. People should be married before they have children. You hear that so often. And, I would say, okay, that's your belief, but why? What does a piece of paper do? As long as they love each other, why is it important that they get married? Now, I'm not telling you that's my belief. I'm just saying that is on the other side of the fence. There's two different opinions. So that person may think that piece of paper, we don't need that piece of paper to say that we're married because we love each other, we have a home together. That piece of paper isn't going to help me one little bit. So we have to remember that some of those biases are from what our parents have passed down to us. So when we look at things, we sometimes look and say, well, there's no other way to do it but the way I think it's right. And we really need, anytime you say that to yourself, you need to stop, because you're showing that you do have a bias. And so, or a prejudice at that point. Be open to thinking about things. I'm not asking you to change your mind. I'm just saying you need to be aware of your own prejudices and deal with them, because they will come up as you're treating patients. So they talk a lot about implicit bias as well. And implicit bias just means that it's really outside of our consciousness. And these are things that sometimes are really hard to identify and overcome. So when we think about that, they've done a number of studies that there are extensive implicit biases in the healthcare system, and it actually affects patient outcomes and patient care. So some of the things that go along with that is how the patients and providers interact. Think about it. I mean, when you have an older patient, they are going to revere the doctor. They believe the doctor is always right. They're going to do anything the doctor asks them to do. Where today, we challenge more. We ask questions. We're asking, is this really the best treatment? So the interaction between the physician and patients differs depending on generation and, again, personality. Those treatment decisions, adhering to the treatment that they prescribed, all of those things are patient outcomes. So if we are not looking at and thinking about what our biases may be that are buried deep, deep inside of us, then we really may not be able to provide the care that we need. And so they give you some examples of what you can do to help recognize some of those implicit biases. So they want you to examine your responses to others to see if it's based on a stereotype. So listen to what you say and then go, whoa, what did I just say? And sometimes it catches you off guard. So listen to what you're saying and be open to seeing, oh my gosh, I'm not sure if something came out. You know, that might be a bias that I have and I never recognized it. Try imagining the patient opposite of what you have as their stereotype. So let's say a poor patient comes in who's just terribly dressed and dirty, and let's not treat them. Let's treat them as they came in Versace outfit with expensive high-end jewelry, and see if it makes a difference on how you treat that person. Again, practice that empathy, putting yourself in the other person's shoes, and learn about the other cultures. It's really important that we take the time. If we know a patient is from a certain culture and we're going to be dealing with them, we need to be able to understand that. So that means we need to take the initiative to go out, learn about the culture, and be a little bit more knowledgeable about what their beliefs are. So let's go to a question. True or false, almost everyone has prejudices of some type. Well, I hope you know the answer to that, and that's going to be true. Although we may not be aware of them, almost all people have prejudices. So we just talked a little bit about this, overcoming those biases, examining how you respond to other, empathy. Try to see that person as an individual, not the stereotype that you're thinking. Try to associate yourself with people from different cultures. Now, sometimes that's hard because here in Allegheny County, we don't have a lot of people from a different culture. But if it's possible, try to do that. We need to remember that we do not have to agree with their beliefs. We aren't probably going to believe them. If they're totally opposed to our values and ethics, we're not going to believe them, but we just need to accept them. There are times that we do have to step in if that may be harmful to them. And again, what we would do is report that to the doctor or the practitioner, and then they could take care of that when they're going in to meet with a patient. We don't ever want to confront the patient about that. So we're going to talk a little bit about what the meaning of culture is. So it's our values and beliefs. It's our social organization, our family structure, language and religion play a huge part in that. It's things we do every single day and we don't realize it. We have one coming up. Easter it's a tradition, and that's something that people, celebrate. It's going to be a very lonely Easter, but there's also Passover right now for the people of the Jewish faith. And so those are traditions that we do based on our culture and our beliefs. Economic status, and again, sexual orientation. So I made this because I thought it was a really cool picture, and it was in your textbook. It's figure 15-2. These are the things that come into play when we're talking about culture. And again, it's those customs and beliefs, attitudes. Food plays a huge piece in it. There's, we'll sit there and we'll go, I'm not going to look at that. I mean, that's terrible looking. But it's very much a part of their culture. I know when you go to Italy, you better be spending 3 to 4 hours at dinner because that's what they expect you to do. It's very slow. It's very different than it is in the United States. You go to France, you get delicious food, but you get smaller portions. The United States is really crazy about food. Never do you see the portion sizes served in the United States anywhere across the world. Their drama, art, music. Think about the Native Americans with their dances, the art. Think about the caves back in the hieroglyphics. This was all part of the cultures that they had. And again, the rituals, the things that we do. And a lot of times people go, we don't do rituals. Well, we absolutely do rituals. We celebrate birthdays. We celebrate Christmas. It may be Kwanzaa. It could be anything. But those are rituals that we do based on our culture. So when we look at what the purpose of culture, it actually helps us provide guidelines for our behavior. It gives life predictability. We know what we're supposed to do. And it actually provides a means for people to live together in peace. Now, it would be lovely if we could do this across the world. I mean, it's even hard to do within a city. But in a perfect world, this is what would happen. Dominant culture refers to what commonly are considered to be the foundational beliefs and ideals of the behaviors of a society or country. So let's talk about the United States. We absolutely have certain dominant cultures. One of them is punctuality. You know how we get about being on time. We harp at you guys because your offices want you to be on time. Not all cultures are like this. If you've ever worked with people from that are Latino or Hispanic, their idea of time is very different. The same thing if you go to the Caribbean islands, believe me, don't expect to do anything fast because they live a very different lifestyle. They are not worried about getting places fast in your car or getting served very, very quickly. Or getting your check because you want it. Time. It's very laid back. And it's interesting because we love going to St. Thomas. And it is so funny because the minute we get off the plane, we can see that. We want to get our suitcase. We want to get our rental car. We're ready to go. No. You'll get your suitcase when they get it out of the plane. They may be talking to somebody. The rental car, oh, they may be talking to somebody in line and asking about what they're doing there. And, we just are so restricted by our time. And so it takes about 2 days to get back into that, we call it island time, where you're relaxed and you just kind of are enjoying it. You can say, yeah, well, we'll get there. It's okay. Yeah, I know I said I'd be there at 1, but if I get there by 2, it's going to be fine. And it's very accepted. Then you have to come back to reality. And so you hit the airport in Baltimore and everybody's pushing and everybody's shoving. And it's just such a difference to see that. The other thing is handshakes. Handshakes we think are very, important. And the stronger the handshake is, the better it is. I'm sure you've even heard people say, my God, they have such a wimpy handshake. Well, in certain cultures, that's what they do. And sometimes touching another person is not acceptable in a lot of cultures, especially if it's a man or a woman. And so we need to make sure that we are understanding the cultures. So in some cases, like in the from China, Japan, those type of cultures, sometimes they'll bow. They don't touch. They don't shake hands. They bow as a sign of respect when they meet somebody. And so again, it's important to remember those kind of things, because if you stick your hand out, it may be insulting to that person. So as we look, we are finding that the U.S. is getting increasingly diverse. And if you look on page 321, table 15-1, it talks about the diversity of the U.S. population. Now, some people aren't really happy about this. They think nobody should come here and only Americans should be in America. I try to ask them to remember that this country was founded on accepting people and immigrants. That's what they did. That is how the United States was formed. We got people from all over and they came to the United States. And so it's kind of interesting when we think about that. That is not one of my biases. I don't care who comes to the United States. I just want you to do it legally. There are certain things you need to go through to become a citizen of the United States. And if you're going to do that, then go through the steps and then welcome, you're an American. Okay? I don't have a problem with that. I don't like the illegal part and those kind of things. But I just find it interesting that people will say, this is America. These people shouldn't be coming in. But that is exactly how we were formed. So when we look at the diversity of the U.S. population, we're seeing white Hispanics at about 60.7%. That's a lot, okay? So we're starting to see a huge increase in the Hispanic population. I'm sorry, white, non-Hispanic. I said that wrong. White, non-Hispanic. Hispanic is about 18%. And we're seeing that grow because we have a lot of people coming out of Mexico and South America that want to get out of the drugs, out of the poverty, that want to come into the United States. So you'll see this mostly in the border states, California, Texas, Florida, those type of things. We have African Americans at 13.4%, Asian population at 5.8%, American Indian and Alaska Native is 1.3%, very, very low, which at the time that, United States was founded, 100% of the people were American Indians. So we've seen that change a little bit. Foreign-born persons are about 13.4%. Now, language other than English spoken at home, and that's 21%. And it's interesting because we're going to talk a little bit about why that might be. Persons under the age of 65 with disabilities is 8.7%. People living in poverty is 12.3%. That's awful. Obese people, we're at 39.8% of our population is obese. When you look at the other countries, that is not the case. And so, as we were talking just about food a little bit ago, point well taken here, we have an obesity epidemic that's really, really not healthy. And people who report as being gay, lesbian, bisexual, or transgender is about 4.5%. So when we look at those figures, like the Hispanic population really isn't considered a minority anymore because there's so many people of Hispanic descent that are in the United States. The key here is we need to recognize the differences, but don't make assumptions. And I know we all have. You know, there's a lot of jokes about people, how many people live together. And in certain cultures, in the Asian cultures and the Hispanic cultures, families live together. You know, that's not something we do in the United States. We may live next to them in the house, but we all don't live in the same house together. In some cultures, that's expected. And so we make fun of it, but essentially they are living their culture. They believe that it's their job to take care of their elders. They're not going to put them in a nursing home. They're going to be in that house and they're going to be taking care of them. So you really need to be careful again with those assumptions. You know, when you're looking at this, you can take it from a negative spin if you have difficulty with cultural differences, and try to make it more positive. Appreciate the different approaches to life. I love going to different countries and seeing what their customs are. They are amazing. Learn about them. If we've got those patients, learn about their culture. Ask them questions. They are not afraid to tell you. Make sure, and we've talked about this with communication, that our patients understand us. You know, English as a second language is not easy. English is actually a very difficult language to learn. And so we've got people coming over who English is not their first language and they're learning. And so we've got to make sure that they are understanding what we're saying. And we also have to remember that members of certain cultural groups may or may not practice certain customs. So I'm always amazed because the college still says Easter break and still says Christmas break. Those are Christian customs. We have a lot of non-Christian people at our college, in our community. And so I am just surprised somebody has not made that known and they haven't changed it to a different terminology. I think other places in the country have, but I think because we're so rural, we're still at the place where we can do that. But I think as we get more and more diverse populations, that language is probably going to have to change. Be sensitive to possible cultural differences related to patient needs. And so let's say our patient comes in and they're from the Middle East and they have the dark, outfit on with a headdress and they are totally covered. And we hand them a gown and say, you need to get undressed and open this to the back. They are not going to do that. That is not appropriate for their culture. We are going to have to figure out a way to deal with that in a way that it's going to respect their culture. Okay? Ask questions about it, learn about it, recognize there's a lot of different subcultural groups. And so even though there's certain cultures, each area of, like, say, South America, they may have different cultures within different areas, just like we do in the United States. It's just very different. So we need to recognize those facts. Oh, this is my biggie. Personal space. And I disagree with this because it used to be 3 feet, and I want 3 feet. Comfortable distance for conversation is between 18 and 24 inches. Truly, it used to be 3 feet. Now they're saying 24 inches. They've taken 12 inches away from me. That is a United States thing. That's one of the cultural pieces. But go to New York City. I'm telling you, there is no way in the world that you can keep a distance of 18 to 24 inches if you're walking down Times Square. You are packed against people. That's one of the reasons I don't care for it. I feel very claustrophobic because there is no personal space there. Some cultures, that is very different. They are used to being very close together. And then there are some cultures that stay even further apart. Some cultures, like in some of the Middle Eastern countries, women walk so many feet behind men. And so we just have to remember that and try to keep that in our mind as we're dealing with people. I used to have a boss. God bless him, he died. But he would get right in your face and talk. And I was not listening to a thing that he was saying because the only thing I could do was think, how can I move? He's got me pinned up against a wall and I am freaking out a little bit. So, we need to be careful about that because if we're invading people's personal space, they are not listening to what we're saying. They're in their mind, they're freaking out. So we need to watch for those nonverbal signs. If you can see them actually start to pull themselves away from you, or you see in their eyes that they're like, what are you doing so close to me? Or their body tenses. We need to realize, whoa, I think I got a little bit too close. I need to back up. The other issue is touch. And this varies greatly from culture to culture. So in some cultures, it's all right to touch. In other cultures, it is not all right to touch. So again, going back to the Middle Eastern cultures, women should not be, their physician should not be a man. A woman should be treating a woman. And that's very true. We would have people from the Middle Eastern countries come here. And I know in OBGYN, they always were scheduled with a women doctor. So that's something that we need to think about. I remember my husband Bill teaches leadership, and he and Dr. Wilcox went on a trip to New York, and they went to see, they have an actual area where Hasidic Jews live. And they are like very, very, very strict Jewish traditions. So my husband reached his hand out and the gentleman shook his hand, but Bev would put her hand out and he would not shake her hand. Well, she was angry. She said, that's just not nice. That's disrespectful to women. Here, in their culture, they feel the only person they should touch is their wife. And so men do not touch other women. Once she learned that, she settled down. Again, I think and this is what she said, she and my husband both, they should have researched the culture better before they went in to make sure that they knew those traditions. And you'll see that. We learn from those type of things. Gender issues, we just talked about a little bit. Men treating women is not okay in some cultures. And the other thing, too, is we've talked about this where the men speak for the women. So, question 2, comfortable personal space in the dominant culture of the U.S. is about 6 inches, 12 inches, 18 inches. And hopefully you answered 18. It's 18 to 24. I'm telling you, they're trying to cut more inches away from me. And I want my 3 feet back. So, true or false? A new female patient arrives at Dr. Hendricks' office wearing a long dress and a head covering. It is safe for the medical assistant to assume that the patient is Muslim. True or false? I hope you said false. We should never assume anything. We have no idea what their culture is, what their religion is. We have no idea. So it's just like looking out and seeing a rich person and a person that's not rich and dirty and kind of scruffy looking, and say, oh, the drug seeker is here, and we automatically think it's the dirty person, but indeed it's not. It's the one in the suit and tie that looks respectable. So we've got to get those stereotypes out of our mind, okay? True or false? Direct eye contact is a sign of sincerity for most cultural groups. Well, that is false. Eye contact in the United States it acts like we're being sincere. When we look at people, when we're talking to them, they feel like, that they're paying attention to us. However, in many cultures, they feel that it's rude or it's very aggressive behavior. A lot of cultures will just put their eyes down, look down, because they feel like looking people in the eye is just, it's not something that they do. So again, it's important that we know people's customs so we are not doing things that are insulting or being rude to our patients. Oh, wrong thing. So traditional Western medicine, we talked a little bit about this when we talked about mind-body medicine, but traditional Western medicine is practiced in the United States. It focuses on the physical aspects, usually medication and surgery. It's also called allopathic. It's based on science, research, everything's proven safe and effective, and our illnesses are actually attributed to factors that can be measured and explained. So if you have, we'll use the coronavirus, if you have a cough and you have a fever, and you have, I can't remember, shortness of breath, they're going to look at those symptoms and they're going to want it immediately to tie it to a disease. That is not the case in in Eastern type medicine, in traditional medicine. They look at things very, very differently. So I want to, the cultural variations of definitions of health. Again, we know the WHO, World Health Organization, says that health is just not the absence of disease. They've acknowledged that there's more than just the mind-body connection is there. But some cultures believe in the balance of the body energy. We talked about that, if you remember, and it was Qi, spelled Qi, harmony with nature, integration of mind, body, spirit, and all of those are really, really important. So there's a really great part in your book, and it is going to be starting on page 325 and then goes to 326, and it talks a little bit about how different cultures view illness, and I think this is amazing. So it talks a little bit about certain, I think it's Hispanic cultures, believe that it is that illness is from something called humors. And what that means is they classify their diseases in different classifications. It is hot and wet, hot and dry, cold and wet, or cold and dry. And if you look on page 325 or box 15-2, if you have an ebook, you're going to see that they base their treatment on those diseases. So they consider hot conditions, constipation, fever, infections, sore throat, and ulcers. Cold conditions are considered cancer, colds, headaches, pneumonia, TB. So you can see there's cold food remedies. So you should be drinking dairy, milk, lima beans, veggies, honey, chicken. Hot food is cereals, eggs, beef, oils, spicy foods, wine. Cold medical remedies are bicarb of sodium, milk of mag, orange flower salt, sage, and hot medical remedies are aspirin, cinnamon, cod liver oil, garlic, and penicillin. Again, we're looking at more holistic treatments. There are some in there that are science-based, but they do a blend of that, and I think that's interesting. When we go back and talk about the different types of religious beliefs and health, there's Christians that believe in faith healing, and they don't want any medicine. They believe that praying over the patient will heal them. Now, if you start to think in your mind, well, that's crazy, what are you going to think? That may be a bias that I never knew I had. Many people use prayer as treatment. It's interesting. I mean, think about Facebook where it says, prayers, please. Going through this, prayers, please. And people will say all the prayers were very helpful. And so 80% of people ask for prayers as they're going through an illness, which I think is interesting. Again, is that because it works, or is it because it makes the patient feel better? What is it? The Christian people who believe in have a Christian background, they're going to say, well, of course, the prayers are healing. Other people are going to say, well, I think it makes the patient feel better. So there's a big difference here. It doesn't really matter. If they're getting better, that's the only thing that matters. When we look at Islam, they believe that what happens in life, including illness, is due to the will of Allah. And so, again, they believe that God is the one that gives people disease or health. Some people believe in the evil eye or evil spirits, and that's, they get into your body, and you need to have, you need to have something that you wear, a token or an engraved stone to ward off evil spirits. Again, if you're thinking, well, that's crazy, I want you to think about this for a second. Think of our athletes. They don't cut their hair at the beginning of the season because they're winning. They have a special token or a pair of shoes that they wear because they are their lucky shoes. We do the same thing. I mean, you wear a certain shirt or pair of pants to an interview because these are my lucky pants. So we all do this. We just don't think about it in the same way. So they also talk a little bit about, we talked a little bit about that mind-body connection. And with the mind-body connection, they're finally acknowledging it more and more in traditional Western medicine. It's like it's taken thousands of years for us to recognize something that the Chinese civilization have used. And it's been very, very effective. I believe in alternative or complementary medicine where you use both. I mean, if I've got an infection, I'm taking an antibiotic, but I also use massage and chiropractic to help balance those things. If you look at the Chinese culture, they believe that the body has two energy forces, yin and yang, and that when somebody gets sick, those forces are out of balance. And again, those pathways get blocked. And remember, that's called qi, that life force, that energy going through. And so what they do is there's different things that they can use. Acupuncture, they can use different types of treatments to try to get the qi moving correctly and get the yin-yang balance back. We talked a little bit about the Hispanic culture and the humors. And so we just have to think about that. While we read in the text about these people are crazy if they think this happens. But if we stop and think, we do some of the very same things. We just look at it in a different way. So we just kind of talked about that imbalance of body energy, the demons and the spirits. Some people believe that you get sick because you're being punished for your sins. There's just so many different things. And again, whether we believe them or not, we respect them. So we talked a little bit about acupuncture, pharmaceuticals, that's medication, prescribed medication, prayer, surgery, lifestyle changes are huge, and rituals and ceremonies. So traditionally in Western medicine, we pick pharmaceutical drugs and surgery. We've started to add prayer in. Some doctors are now trying to, and I always like doctors of osteopathic medicine because they believe in trying to make change instead of giving them a medicine or surgery. So they actually work with them to see what's going on in their life that they may be able to change to help remedy the situation. So let's say it's high blood pressure. What is the situation? Well, my daughter's driving me crazy. Well, let's find a way, maybe some counseling or something that would help you to decrease that stress, have somebody to talk to, so we don't have to put you on a medication. Now, if that blood pressure is high, we're still going to put them on medication, but we're going to work with them to see if we can get them weaned off of that. The rituals and ceremonies are amazing. I was able to see a number of them when I was working at Bayview, and they were mesmerizing. And I'm telling you, if they would not have performed those rituals, the patient did not feel like they were going to get well. And so a lot of this belief is biology. People who believe in their cultural rituals and ceremonies, it's very important we allow them to do that because they do not think that they're going to get better without it. And so it's really important that we acknowledge that that's fine as long as they're not doing anything that's going to harm themselves. All right, that is the end of Chapter 15, Part 1. Chapter 15, Part 2 will be upcoming.